know about Zach Plaistow? Has anyone heard of him? So he's really the whole reason why states have started creating laws surrounding concussions. So Zach Plaistow, he was a football player in Washington State. He was playing football, he sustained a concussion, he was not taken out. He went back in, he got another hit. As he was walking off the field, he collapsed. He had a major bleed in his brain, and he was helicoptered out to a hospital. He had most of his skull removed, and he's basically permanently disabled. And he's one of the lucky people who had second impact syndrome, which is basically what happens when it's a rare complication of a concussion. When you go back before you're fully healed and you get a second hit, you can get bleeding in the brain, and half the time that results in death. So he's one of the lucky people who actually lived, but he's permanently disabled. And so that state was the first state of the United States to actually pass a legislation surrounding concussions, saying that people should be educated, and if there's any suspected concussion, they should be removed, and that they can't come back until they get physician clearance. So now there is many states in the United States who have such a bill, and New Hampshire is the latest example of that. It was signed into law on August 6th. I was actually at the signing. Basically it calls for immediate removal of anyone with suspected concussion, and that they can't go back without written consent from a physician and from the parent. And it also calls for education to coaches and athletes about concussions. So that is new, and so it's an important, I think it's important, I think it needs to be improved a little bit, but it's just, the main purpose of it, I think, is to increase awareness of concussions. So some quick concussion facts. So in the United States, there's about 300,000 sports-related concussions every year. So that's a lot. And a pretty staggering number, I think, is 15% of all high school injuries are concussions. So if you take all injuries, 15% being concussions, that's a pretty big chunk. And early identification and proper management is really important to provide the best possible outcome. So what is a concussion? A lot of people, frankly, they get diagnosed with a concussion by their primary care doctor, or they go to the emergency room, and they're kind of left with, I don't even know what that is. I have no idea. So I think it's important to try to tell people a little bit about what that means. So really the actual definition is a trauma-induced functional deficit of the brain. So what that means is any force that causes jarring within the brain. It doesn't even have to be an impact to the head. It could be an impact to the body that translates to the head. It causes shaking within the skull, stretches the neurons, and then the neurons don't fire correctly. And then it leads to all of these symptoms that we typically see that we'll discuss. So it's really a functional deficit of how your brain works. Your brain looks normal. So if you do a CAT scan or an MRI with a normal concussion, it looks completely normal. You wouldn't be able to tell the difference between someone with a concussion and someone without one. Okay, so it's almost like a short circuit of the brain. Loss of consciousness is not required. Okay, so 80 to 90% of concussions do not involve loss of consciousness. And so there used to be the thought of, oh, you were knocked unconscious, you couldn't have had a concussion. So it's the opposite. It's actually pretty rare with concussions that you actually see loss of consciousness. So we'll go over some common signs and symptoms because it's important for everyone to be able to recognize these. So a sign is what you're going to see. So if someone gets hit, and you're looking at them, and here's the things that you need to look out for. So appearing dazed or stunned, being confused about an assignment or a position, forgetting plays, unsure of the game, the score, or the opponent, being clumsy, answering questions slowly, loss of consciousness, but as I said, usually it actually doesn't involve loss of consciousness, but certainly if someone loses consciousness, by definition, concussion. Okay? You can have behavioral or personality changes. Sometimes people will just be laughing inappropriately, crying, more emotional than usual, and you'll just be like, what's going on? Why are you acting that way? And so that's something important to look out for. Inability to recall events before or after a hit or fall, and vomiting. Okay, so those are all things that you need to look out for and say, hey, I think we might have a concussion here. Symptoms. So a symptom is basically a complaint of someone who's injured. You say, how you feeling? These are the things they might tell you. They might say, I have a headache or a pressure in the head. So this is important. Some kids don't know what a headache is. They've never had one. So you say, you have a headache? They're like, I don't even know what that is. So they don't even describe it as a headache. They might just say, I have a pressure in the head, or my head doesn't feel right. So nausea, balance problems or dizziness, visual problems, things kind of seem blurry or difficult to focus. Sensitivity to light or noise is very common. Feeling foggy or slow, problems concentrating, confusion. And sometimes the best people can say is, I just don't feel right. And even that's enough to just say, okay, I think we might have a possible concussion here. The important thing I have here bolded is symptoms can be delayed. And this is so important because this is the whole reason why we say, if in doubt, you sit them out. Because it is quite common, especially in kids, to have the symptoms be delayed. So they don't always happen immediately. Sometimes 15 minutes later, an hour. Sometimes the kids, they don't even recognize it till the next morning when they wake up. They say, oh, maybe I had some minor symptoms. I just thought, I was tired from the long game. And then when they wake up, they're like, whoa, something's not right here. And it doesn't become quite obvious until they go into school the next day, start trying to think hard, and then they're like, this isn't working. So that's why if there's any suspected concussion, we know that the symptoms can be delayed, and so we should pull them out, see how they feel the next day. And if the next day they say, I feel fine, I feel great, you can say, okay, then maybe it's reasonable to have you go back. But if you're really suspecting it, you should hold them out for that reason. Questions about any of those?
Can some of these symptoms be lifelong afterwards, so depending on the severity or?
Usually not. So by definition, usually a concussion, it's transient. So you have these deficits, they get better over time. Are there instances where people have what's called post-concussion syndrome and the symptoms last instead of days to weeks, months to years? Yes. In very rare instances do people have those symptoms forever. That's pretty rare, but it can happen, but rarely.
Do you rate like a concussion depending on the severity of it, like on a scale? Like this is a type 1 concussion, a type 2 concussion, or a type 3 concussion?
It's a good question. So we no longer grade concussions. There used to be a whole bunch of different grading systems. There was a CAN2 grading system, there was grade 1, 2, and 3, and they used to base it off of certain things like loss of consciousness, how many have you had, and what they found out is their criteria for grade 1, 2, and 3 had no prognostic indication whatsoever. Okay, so loss of consciousness turns out not to be a factor in severity of a concussion. As a matter of fact, it may even be protective. Those short episodes of loss of consciousness might even be protective. And they don't know why, but they think of it as like a short circuit, like your computer starts getting slow, and you'd almost be better off just restarting the thing than just having it go off. So that loss of consciousness, and that might actually be a brain reset button that kind of starts things over and might be a little bit protective. It's kind of shutting things down and restarting it. So the grading system we don't use anymore. And really what I tell people is, I can't tell you how severe your concussion is until the day you walk into my office and I say, congratulations, you can go back and play. Because you might have very minor symptoms and someone says, oh, this is a mild concussion. But if those mild symptoms last months, that's not a mild concussion. And on the contrary, you could have horrible symptoms, and they only last a day or two. And I'd say, is that really a severe concussion? So you really can't, I can only tell at the end of it and say this was bad or not. And so we don't use that grading system anymore. So usually when I have like a referral or I see someone and they say, oh, you had a grade whatever concussion, I know that they're probably not as up to date on some of the literature as they should be. So why do we care? Why do we need to immediately recognize and treat concussions? One of the reasons is concussions, previous concussions, multiple concussions can increase your risk for more concussions by up to 6 times. Okay, so that's like a big deal. Okay, saying, well, I've had 2 concussions, so I'm 6 times higher likely to get a concussion than my friend sitting next to me who's never had one. So we need to really prevent those concussions from accumulating. The possibility of second impact syndrome, which is what I talked about before with Zach Lystedt. So this is rare. It happens, but it still happens a couple times a year in the United States. It's basically if you go back before you're fully healed, your brain can't really accommodate trauma, it can swell, and then bad things can happen. So that's second impact syndrome. It's rare, but really if we just pull people, then it shouldn't happen. So we worry about additive effects, so concussions occurring with less and less force, symptoms lasting longer and longer. So those are patterns that we worry about. And it doesn't happen in everyone, but in the people who it does happen in, we're concerned. Post-concussion syndrome, which we also kind of talked about. So basically what that is that's when your symptoms don't go away. Usually, 80% of concussions are better in 2 weeks or less. So when you start talking about, I've had symptoms for months, that's when we start calling it post-concussion syndrome. Definitions are variable, but a lot of people use 3 months as once you reach the 3-month threshold that you're considered post-concussion syndrome. Chronic traumatic encephalopathy, also called CTE. So this has been in the news a lot lately, and this is a consequence of most likely repetitive head trauma over a long period of time, okay? Not from 1 or 2 concussions only, but repetitive injuries to the head. And we used to think that this only occurred in like boxers. This is like the classic like punch drunk, like they're just not right anymore. But now we've started seeing this in NFL players, NHL players, and not old people, and young people in their 30s who have had this. And basically what it is you develop dementia, depression, and then usually things in their life kind of start spiraling out of control. And unfortunately, a lot of these cases have ended up in suicide. And we don't know if Junior Seau, if he had this, but it's certainly suspected. There's been plenty of cases in the NHL and NFL of people committing suicide. They have their brain studied and they had CTE. We don't know who it occurs in and why. There's probably some genetic predisposition, but the common link is repetitive head injuries. Not even just concussions, it could be subconcussive injuries over time. So we need more research into why this happens and to who. But
so is this a link to Alzheimer's as well?
There's a suggestion that some of the things in Alzheimer's brain look a little similar to what we see in CTE, but there's some distinct differences. And we also think that people who might have CTE might be more predisposed to having Alzheimer's type syndrome. So there's some similarities, maybe some differences. So they're still trying to investigate that. And the last thing is adolescents usually have worse symptoms and they usually last longer than adults. Okay, so I used to work at BU and MIT. I was one of their team physicians. There's such a huge difference between a college athlete whose brain is really fully matured in a high school and adolescent brain who's just much more vulnerable, and they're taking way longer to get better than my college athletes were. All right, so I want to just bring you through a quick kind of protocol of what it should look like, how a concussion should be managed. Okay, so the big thing is preseason impact testing, which I'll go over, and then education. So I go out to the local schools, I go to their sports night, and I try to talk to go to the parents' nights and make people aware, make the coaches, parents, and athletes aware. Okay, so that's a big part of it. And then preseason baseline impact testing. So impact testing, essentially, it is a computerized neurocognitive test. So it measures brain function, verbal memory, visual memory, motor speed, and reaction time. And the idea behind it is, if we know how your brain works when you feel good, before you ever had a head injury, then you get a head injury, we can use this as an objective measure of, is your brain working normally again? Okay? We need something better than, hey, how you feeling? You good? Get back in there. You're fine. Because sometimes people feel fine, but their brain really isn't working correctly. And sometimes, frankly, they're lying to us. They want to get back in. It's playoff time right now. And people might not be as honest as they should be with their symptoms. So we need some objective measure of saying, how's your brain really working? So this is really the best tool we have right now. Is it perfect? No, but it's better than nothing. And it's one piece, so I don't make decisions solely on this, but it's an extra piece of the puzzle to kind of try to help me figure out when someone's ready to go back. Questions about that?
How long of a test is it?
It's about, depending on how quickly you take it, generally about 20 to 30 minutes. It's done on the computer. We offer free baseline testing to as many people as we can, a lot of the local schools. Ideally, you'd go into a computer lab and it's moderated, but we do have the ability to have you just take it at home. Do it on a computer, you need just a mouse, and it's asking you, remember these letters, these words, and then it'll ask you later. You have to say yes or no, is this a word? Remember this shape, design, you have to remember it later. It's going to test your hand-eye coordination with the mouse and clicking things on the screen, and then also reaction time, just how fast can you click that mouse button in response to certain stimuli on the screen.
Now, I had coached high school football before, and they used to take kids off the practice field to go do their baseline testing. But they didn't take every single kid.
Yeah.
So I didn't know, I never asked the question why.
It could have been because you only need to do it every 2 years, so it could have been that they had the test already. And maybe they were just doing it one at a time because they only had so many computers. I don't know. But in an ideal situation, you have a big computer lab and you have, 10 people take it at a time and then have the next group come in.
And does that testing become part of the kids' medical file?
Yeah.
Is it shared with their primary care physician, and that becomes...
It depends who's administering it. So for instance, we administer it. We have a big database of everyone who's taken their test. And they're free to have it. We can give it to them, or we just hold on to it in case they ever have an injury. And it's not like we hold on and say, no, you can't get it, or you have to come see us, otherwise we won't give it to you. No, it's part of your medical record, let's say, and we'll give it to you whenever you want, but generally people don't care about it. They just kind of call us up if they have an issue, and then they can either retake it with us, or we give them their baseline, and then they can take it somewhere else and be retested. So who can take it? I recommend anyone in contact sports take it. Generally, the youngest I have people take it is 11, 12-year-olds, and they should take it every 2 years until they graduate high school. And that's to account for normal brain development. So they're going to do different on the test as their brain matures, so we need an updated baseline every 2 years. Okay? And once you get into college and you're an adult, you only need one baseline test because your brain is kind of where it's at. It's not going to really develop much more at that point. All right, so back to the board.
I have one quick question.
Yeah.
Those that have had concussions before, and it's saying they're 6 times more likely to be re-injured. Are they any more of an emergency to be seen? I know we pretty much try to get people right in within a day or two. Is that any more emergent if they have had previous injuries before, and then say someone that just for the first time?
Not necessarily. I mean, so we try to see people as soon as possible, and everyone should be seen within the first day or so. So I think it's all individually based on their symptoms, so you kind of have to say how are they feeling, because there's plenty of people who are doing much worse off with their first concussion compared to someone who's had 4, and they might still have minor symptoms. So it doesn't necessarily mean that like, oh, you've had 4, we better see you within the next hour, versus if it's their first one, we don't have to see you for the next day. It's based on just kind of severity, how they're presenting.
Do your chances continue to double up? Like if you're 6 times more likely after your first one, is it like 12 times after the second one and so on?
No, it hasn't been shown to be kind of logarithmic like that. So they showed that it was basically after you've had 2 or more, you're 6 times higher likelihood. And then they did show some correlation with the more you have, it seems to be that the shorter duration in between the concussions and the longer the symptoms last. So there's some rough correlations between that. But not everyone follows those patterns. All right, so a concussion protocol. So if someone has a suspected concussion during a game of practice, they should be removed immediately, never return until clearance. In an ideal world, we have an initial assessment by a medical professional. Usually it's the athletic trainers, and they're great. This is like one of the main things that they're trained in doing, is identifying concussions, pulling people, and making sure people aren't going back in. So they should be removed. Then they need to make the decision. Should they go to the emergency room, or can they follow up with their primary care doctor or concussion specialist, okay? If there's no medical professional there, we do not expect untrained medical professionals to make that decision. So if you suspect a concussion, they should be brought for medical evaluation, okay? Emergency room, call the primary care doctor, a walk-in clinic, call a clinic like ours that can try to get you in the same day. But it shouldn't be left up to the parents or the coach to decide, hey, is this a concussion? Is it bad? Do they need a CAT scan? Don't want that decision to be in anyone's hands other than a medical professional. So if any suspected concussion, it really should seek out evaluation that day. Okay? So let's say that they're seen, you should give them verbal and written instructions, make sure the parents are notified, and tell them that they really need to rest, both physical rest and cognitive rest. So this is big. So what do I mean by rest? So physical rest means I don't want people doing any activity that gets their heart rate or blood pressure eat, drink, walk, sleep, talk, that's about it. I don't want you doing anything else. And then also cognitive rest, which is maybe even more important. Because people get the physical rest. But cognitive rest, things like reading for fun, testing, texting, phone calls, computer, video games, all that stuff makes people feel horrible, and it makes their symptoms last longer. So we want all those things to really be avoided, okay? A lot of times we write out special accommodations for school. So this is like the majority of some of my visits is saying, okay, how's school going? What's going on? What bothers you? What doesn't? How can I modify your daily schedule to make it so you can get through a day and feel okay and not fall too far behind? So there's a lot of that during my visits. So after the initial evaluation, you make sure that they don't need a CAT scan, that nothing bad's going to happen. They should follow up with a physician with some experience treating concussions in the next few days. At that point, I usually like to perform an impact test at their initial visit to see if their scores have dropped, and if so, it might give me some indication of severity of the concussion. Then we start a graduated return to play protocol, which is, exercise. And we do that when and only when all the symptoms have resolved for at least 24 hours, and that's at least 24 hours, and their impact test is back to normal. So that's the general kind of rule of thumb, okay? So once that happens, we get them back to physical activity, and we do that over a minimum of 5 days. They should be monitored over those 5 days to make sure with the graduated exercise program that they don't have return symptoms. And then you make the final decision. Are they ready to go back to that contact or collision sport? Are they ready to put the football helmet back on? And you take everything in consideration. How many concussions, impact tests, balance scores, how they're feeling, and then you come up with a kind of final decision. So people ask, how fast can I get back? So my goal is not to get people back as fast as possible. I want it to be as safe as possible. But the true answer is 6 days is the soonest possible you could ever get back from a concussion. And that would be if and only if you had symptoms and they lasted, say, an hour and you were already better by the next day. And that's the only way you could ever get back in 6 days. Otherwise, it's going to take longer, okay? Because again, you have to be symptom-free for 24 hours, and then you have to progress through 5 days of physical activity before you're cleared, okay? Questions about that? All right, so summary. Any suspected concussion needs to be removed immediately. You can never return to play the same day, no matter how minor your symptoms are. Rest is the key, and you have to be completely symptom-free before returning to sports and go through that gradual progression. All right, so lastly, besides rest, can we do anything else for a concussion? And yes, absolutely we can. So there's other things that we can do. So if you see someone and they said, yeah, I got a concussion and I'm 2 months out and still all they tell me there's nothing I can do, they're just telling me to rest. There's other things that we can do. I recommend fish oil to all my patients. It's been shown to have a neuroprotective effect with concussions, so I advise that for every one of my patients. Vestibular rehab is very important, and I usually start that if people are still having balance issues, dizziness issues, or eye issues 2 to 3 weeks after their concussion. Christy will be talking a little bit more about that. And lastly, post-concussion syndrome treatment. So like I said, if you're having symptoms that are just going on and on, sooner or later we got to say, I know maybe I'm giving you a medication to cover up your symptoms, but maybe I should do it just so you're more functional and you can kind of get back to school, get back to everyday activities. So I do treat people for chronic headaches, concentration issues, depression, sleep issues, all those things. Certainly if they're ongoing, they should be addressed.